Good morning, I'm Mabel Jung, and you're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. We're of day one of this event, and I'm so pleased to have with me Dr. Susan Weaver, who is Chief Medical Officer at BlueCross BlueShield of North Carolina. Good morning.
Mabel. Thank you. I'm happy to be here.
Well, BlueCross BlueShield has made significant investments into different tools, one of them an online tool that allows people to comparison shop. How big a factor has that been for customers?
Well, it's been interesting because we believe, like many in healthcare, that the lack of transparency contributes to the waste in the system and to the high cost of care. So we have actually had a member transparency tool for 3 or 4 years, since early 2012. And that one is very robust and it has cost and quality data, but you have to be a member. So as people start to shop more and we want to get the consumer more engaged in the care themselves, we wanted to provide a tool that the public would have access to. So in January we launched a public consumer transparency tool, which right now just covers cost data. It's a total cost of care for the episode. So it's meant to be consumer friendly, so it's how a consumer would shop. Covers about 1,200 of the most common codes. For us, that represents about 80% of the more elective things. So if you're having a heart attack, we don't want you to comparison shop. You should go to the nearest hospital. But for more elective things, it could include having a child or having an elective surgery or an elective radiology procedure of some type. We believe the consumer needs the information to be able to shop. And it's intended to be a single point of information. I always use the example of car shopping. You don't just test drive a car. You might look at consumer data, you might talk to friends and others that know about cars. This tool is meant to be the same. A starting point, start a conversation with your physician or ordering provider so you can make a more intelligent decision.
Overall, have you found that customers appreciate the transparency, or also do they feel a little bit intimidated by so much information that's out there for them now?
I think both. So I think they've been very engaged, very excited about it. It's still confusing. Healthcare in general is confusing, and part of what we've tried to do with this tool is to simplify it a little bit. So for instance, you don't search by ICD-9 or 10 code. You don't search by codes or CPT codes because that's not how consumer thinks. You search by the common language that a consumer would use, and it's intended to be the entire episode of care. So much what happens is you ask a physician what's their fee, but then you go to the hospital and you didn't realize there were also hospital fees. There might have been lab or other fees that weren't included in the price the physician gave you, so it's confusing. This is the entire fees, including the member out of pocket and whatnot. So it helps. It's still confusing and they need to have a conversation.
Right. As a physician yourself raising a large family, have you found that the road to getting more transparency and more information has been a good thing for your own family, or have you found holes in the system where you feel like, yes, we need to do this better?
We definitely need to do it better, but it's been a good thing. I have one of my children needed a MRI, and when we moved our plan to the high deductible kind of plan, I had the conversation with the children about, ask about costs, because they're all out of the house. They don't live at home in college. And so he was away and needed a test, and the orthopedic surgeon that he was chatting with called me to say, you've really raised him right, because he wanted to know if the MRI that was being ordered was going to change the care at that point in time. And the doctor said, no, it would help me, but first we're going to do physical therapy anyway. So my child chose to do physical therapy first and avoided the MRI because he got better and didn't actually have to have it. So if you give consumers the right information, they at least can begin the discussion and get to a better place. Not every consumer wants that, but I think the majority do.
Is there enough attention being paid to teaching consumers on what questions they should be asking?
Probably not. It's a great point. That's another area we can try to educate. And we are working in North Carolina with a new consumer engagement platform called Blue Connect, that the transparency and the cost is just one component, and it has lots of other information. We also are developing specifically for our exchange population. We have a large exchange membership, and many of them have never had insurance. We're doing a whole new program on onboarding, sort of the how to use health insurance so that you get the things you need at the highest value, so high quality at the lowest cost. But we've had to change the way we approach that because that membership is not used to having insurance. So yes, we all need to do a better job of helping them.
And what about the provider experience? We've been talking a lot about the customer and how it's a retail situation for them now, so we want to give them more power to make their own decisions. Are the providers feeling overlooked a little bit, and what could help them do their job better?
Well, I think the transparency tool helps them too. So many of our programs, we work very collaboratively. We're fortunate in North Carolina to have the most robust provider network, and as a single state Blue, we have a lot of great relationships with our provider network. They were engaged. We have provider advisory groups, which help when we're looking at a transparency tool and other things we're doing. We work very collaboratively with them. But one of the things we're doing as we move to value-based care is we're incentivizing providers to provide high quality but a lower overall total cost of care. So even when they're referring out to different things, to different types of services that they don't do in their office, a transparency tool can provide them with the information they need to find who, from a referral standpoint, is a lower cost, higher quality provider. So it will benefit them as well.
What is a big takeaway you want attendees at this conference to have, Dr. Weaver?
A couple of things. I think that we're not moving fast enough toward value-based care. I think transparency is a key component of that. The more transparent we can be in all aspects of medicine will help facilitate that and hopefully expedite that move. People always talk about for 5 years, it's a 5-year roadmap. I've been hearing it's a 5-year roadmap to move away from fee-for-service to value-based care. But every year it's a 5-year, it's like the roadmap just keeps moving out from where we are. And so I think we need to collectively work together with the consumer at the center to accelerate that path.
Okay. Well, Dr. Weaver, we certainly appreciate your thoughts here today. We look forward to checking in with you again next time.
Sounds great. Thank you, Mabel.
And I've been speaking with Dr. Susan Weaver. I'm Mabel Jong. Thanks for watching.